I'm pleased to share that Ms. Baccalaureate is joining us. Certainly, the blooms and the flowers and the buds that we've enjoyed experienced a setback of a spring snow today in a freeze overnight. But they will persist and they will continue, and we will have a great spring and summer despite the late freeze. In the same way, Ms. Baccalaureate has come to us week after week over 13 plus months to share with us the health update. And I just want to share our appreciation for her sharing the data with us week after week. And we are learning more each day now that we have students in school. So I've asked Ms. Baccalaureate to really focus in tonight on some of the lessons we've learned with preschool through third and self-contained classrooms back. And so we have, right around 50%, 60% of our students in the buildings. And Ms. Baccalaureate and her team have really learned a lot, and they're going to share a little bit of that learning this evening. Ms. Baccalaureate.
Well, I'll say an official good evening to you trustees and to Dr. Swift and members of the community who are watching. We can just move right forward into the first slide. I like to start with our CDC operation, schools operation framework. It's the operational strategies for schools, that has these 4 different levels. We continue to be in the high transmission or above the 100 total new cases per 100,000 people in the past 7 days. So one thing that has changed since last week is that although we are still in this high transmission zone, our percent positivity has come down. And that, of course, is our way to tell that we are doing the right amount of testing so we can be more confident in that upper graph. So I do want to point out, what does it mean to be in this high transmission for the CDC? And what they have kind of calibrated on their guidance to schools is that if you're in the high transmission for elementary schools, they say that there should be at least 3 feet of distance between students and classrooms. Cohorting is recommended when possible. And the issue with them saying 3 feet is that our local and state health departments still use 6 feet as their measurement for determining who is a close contact and who needs to quarantine. So we know if we have lots of kids in a classroom who are closer than 6 feet, while the CDC says that's okay, they are much more likely to all be quarantined if there's a case in the classroom. The same thing for middle and high schools. They say if you can use cohorting, which is small groups who stay together all day, which we're really not able to do at high school level or middle school, that we need to have at least 3 feet of distance. If you can't, it's 6 feet. So again, there is this conflict between the CDC guidance and our operation here on the ground with how we determine close contacts. So I'd like to spend a little bit of time, next slide please, on the COVID-19 case dashboard. I've gotten a lot of questions about it, and I'd like to just try to clear it up as best I can. This dashboard represents cases that were on a school campus during their infectious period. This is per the MDHHS requirements. We didn't just make up what should be on this dashboard, so that it is a little bit limiting. What we do is, if you go to the case dashboard website, you'll see that there are tabs at the bottom of the spreadsheet that are match with the week that goes from Monday to Sunday. So we are recording cases that are student, staff, and contractor, and we post them to the current weekly spreadsheet immediately when they are confirmed and when the school has received communication. So you will see the number ticking up as the week goes by. We know that there are other cases involving students and staff who have not been on campus, and I'll talk a little bit more about that later. I just want to caution everybody too to not read in, if you see multiple cases at one school, that means there's been an outbreak at that school. And it's been pretty common at a school. There could be multiple unrelated cases. So just a caution about making interpretations. So let's take a look at the last 3 weeks of case dashboard. Next slide, please. All right, so I've just kind of pulled from the dashboard to show over 2 full weeks and our partial week that we're in right now. So as you can see, we haven't had a huge amount of cases that have been reported on the dashboard. From April 5th to 11th, it was 7. The next week, it was 12. This week, currently, we've had 4 student cases, a staff case, and a contractor case. So I would say that these cases represent maybe a third of what we hear about and what we are aware of in schools, but we're not on campus at that during the time that they would have to be reported on this dashboard. I also wanted to point out the total schools with cases. We have several elementary schools that have not had any cases yet, which is great. So we'll continue to be updating this on a daily basis. And what I'd like to do now is focus in on the elementary student cases, which is in our next slide. So let's talk a little bit about what we've learned from our elementary student cases that have happened since that first Monday that we came back. And I'd like to take a little bit of time and walk everyone through this. We have had 12 student cases. These are all from the dashboard. Each case goes through the lengthy and detailed case investigation and contact tracing process that involves our school nurses. I talked through this a bit last week. It involves our school nurses calling the family, talking through when symptoms developed, and determining when the contagious period was. There are multiple ways. Every case is unique. There are multiple differences with every single step. And then we run the case data by the health department and then determine the quarantine dates for anybody who needs to quarantine. Those 12 student cases have occurred in every grade that's in school right now, preschool through 3rd grade. They've occurred in 9 schools around the district. Again, not every school has had cases. Of those 12 student cases, there have been 9 siblings who would have been in school if we were face-to-face in 5 additional buildings. And, we have families who have multiple children in our schools, which is awesome. And so it's just a little bit of a preview of what we'll be looking at coming back to school is multiple cases if a family gets hit hard with COVID. And one thing I wanted to point out is that our high school athletic antigen testing has worked in both ways. We've had elementary students who've tested positive who have an older brother or sister who's one of our athletes, and we've had athletes test positive who have younger siblings. So we've been able to contact trace from that as well and catch cases earlier from that. So from those 12 student cases, we've quarantined 32 students and just a couple of staff. And the great thing is our fully vaccinated staff are preserved from having to quarantine because of their vaccination status. I do want to say, I know that hybrid kind of gets a hard rap sometimes, but if we were not doing this 2 days a week for one group and 2 days a week for another group, we would have double or even triple the number in quarantine. The cases that we've had have been in either the Monday, Tuesday group or the Thursday, Friday group, and they have not impacted whichever is the other half of the week. And so we've really contained the cases and the impact of the cases to each of whichever group that it's in. And that has preserved in-person learning for the other half. So that is one good thing about doing our hybrid approach. And we know that that teachers and principals and other school staff are doing their very best around distancing and throughout the school day, helping students really stay distant. I do want to say it is much harder for the preschool, young 5, kindergarten classrooms to do that, because naturally kids just need to be around each other in closer proximity. And so it is more likely that we will do a classroom quarantine for one of those younger grades. And in fact, we did that today with a young 5's classroom. For the older grades, we are meticulously looking at distancing, at what's happening through the school day to try to really more strategically quarantine kids. We don't, quarantine is a big deal. It is 14 days away from school. Kids have just come back to school. We really don't want to do it, but we know it's necessary to help prevent spread in a school. So we know as we're moving forward with bringing more siblings, more grades back, and there will be more siblings, that we will have this greater impact across different school buildings. We've also learned that for a lot of those 12 student cases, they started with very mild symptoms. It might have even looked like allergies. So directly asking parents to just really focus in on your students. Most parents have been extremely conscientious, and I just want to say thank you. But a few have sent their students to school with symptoms, and or they've had a known case in their family, and they've still sent their kids to school, and ending in multiple layers of exposure and quarantine. So we're going to be doing some messaging and updating our daily student questionnaire to be really clear, especially because we don't know where the variant is hitting. And it seems like the COVID is racing through families in a different way in the spring compared to in the fall and winter, when we had different cases then too. So just to err on the side of caution and keep all the siblings home if there is a case, and call the school nurse and talk through what the situation is, if at all possible, so that we can prevent kids who are pre-symptomatic or asymptomatic from entering the classroom. All right, so parents are our best partners in preventing COVID-19 transmission in the classroom. I already said a big thank you. I will say it again. We know that you are working hard. You are keeping those masks on. You're teaching your kids at home all about how to be safe. So we do have, as we move forward, we do have a few things to really emphasize with parents. That daily pre-screening, that update is coming soon, keeping all students home. If anyone tests positive, or even if anyone has COVID-like symptoms, please keep your children home. And I know this is a different and stronger message than what I've said before. And think of your school nurse really as a resource. And I've put the link to the Nurse Care Corner. There's a ton of information on there directly from our wonderful AAPS school nurses. And you can get in touch with your school nurse that way if you are not familiar with who she is. And we've also hired some additional nurses for the spring so that we really can help families navigate through symptoms and exposure and testing. We also just need families to be aware that it may be that your child has to quarantine. And Washtenaw County Health Department is the public health authority. They have the say of who quarantines. We present the information. We do all of this detailed investigation and then share it with them. And then they say, okay, so-and-so needs to quarantine, or they don't need to quarantine. So being our strong partners in that area too, and understanding that sometimes in a pandemic, quarantine is necessary. So, bigger picture as we move forward, we will be looking at continued vigilance inside our school buildings with the Super 6, the masking, distancing, ventilation, public health protocols, et cetera, cleaning, et cetera. As Dr. Swift mentioned, we are encouraging staff who are not vaccinated and parents who are not vaccinated and students just to get tested regularly as possible, but especially to get tested if you have even slight symptoms. That is really the most important thing. There are more community vaccination opportunities coming for students 16 and up. As we hear of them in the school district, we will send them out and let you know. From what I am seeing, our high school students are eager to be vaccinated, and we want to support that. I also wanted to mention that I put in AAPS. I didn't even tell you this yet, Dr. Swift, but I put us in to be a potential vaccination site if the health department decides to have special clinics. I put it in, and school nurses who are watching, I said you would help vaccinate students too. So just giving everybody a little information right now about that. So I don't know if it's going to happen. I've just filled out the form saying that we're willing to do it, and I hope we can. As we go back to school too, we have the same number of people doing case investigation and contact tracing. We'll have a lot more students. So it's more likely that we will need to just have a virtual day so we can work through a case investigation and then bring everybody back. And maybe the class would, or some people in the class will quarantine, maybe not, but we're going to probably need to do more of those. Okay, we just need to have a virtual day so we can do the investigation if we have multiple investigations going. Our record so far is that we had 11 case investigations in one day. That was a really hard day, but we did it. And we're getting better at it all the time. We're always improving our systems and trying to do better. And I just want to underline something that Dr. Swift said earlier, that we're aware of all of these other cases, right? So we have our case dashboard. We know who's been in school when they're contagious, but we also know there's still quite a bit of community transmission happening in the community. And because we'll do a case investigation and then we find out, oh, they're positive, but they haven't been on school property. So we can't count them on our dashboard. So I just really want to caution parents. It's spring, everyone can be outside. If you are having close contact with other families, put the masks on. Kids are used to wearing them now, and just try to be careful because that community spread can walk right into the door of the school. So everyone's interested in the results from the Pioneer drive-through. So first, for our numbers, we tested we, meaning the MDHHS contractors, they tested a whole bunch of people, 522 rapid tests, 13 of those were positive. They also did 47 PCR tests, 10 of those were positive. And then sorting through, I worked with the person today to really sort through which cases were which. And we had 16 unduplicated positives, or 2.8% positivity. So that is good. That shows that, of the people who showed up to do a test, there was very low incidence on Sunday. We were so happy to see families, cars were packed full of kids. I heard babies screaming. So sorry about that. But, testing, it's still up the nose. Lots of drive line hang tags. We're just really happy to see a lot of people that appeared to be from AAPS. So some of the challenges that we faced on Sunday were long lines and wait times. Unfortunately, the MDHHS contractor cut off the line early, and then we got him to reopen it, but that happened. So a lot of people left. We could see that some cars were leaving the line because they just couldn't wait that long. Another factor was that I had several people reach out to me to ask what type of PCR would it be, and it was the quote tickle the brain, way up the nose swab. And I know that some people decided not to come and they wanted a PCR because of symptoms, but they decided not to come specifically because of the specimen collection method. So we are really taking all of that into consideration and looking at some other options as well for testing, which I can announce right now. All right. So we're developing a partnership with Linx Dx, which a lot of people in the community are very familiar with. A lot of people have gone to their site, which is at Wagner and Liberty. It's in the parking lot of the 242 church. They offer painless PCR testing. I have on here that it's rapid. It's not as rapid as a Binax Now test, but it's they pretty much say it'll be a 1-day result return. They will guarantee within 2 days. We don't want people to have to wait for hours to get their test. So we're improving the flow with them. And the other nice thing about it is that individuals, like our student athletes, for example, can put in a code and share their results with the district. That is voluntary, but they can, and then it is a much easier process than working with the MDHHS. So we have a Linx Dx event that is scheduled for Huron High School. We decided to do it on the more east side of town because of the Linx Dx location over here, right by Wagner and Liberty, to try to just get out geographically to a different area. It will be from 12 to 4 on Saturday, and we will have additional details and signups coming soon. It is always better to pre-register ahead of time. And we think that we have this set up so the process flow will be smoother and we will not have the wait times that we did on Sunday. We're also continuing with high school athletic antigen testing. And today, for the first time at 2 schools, marching band and flag had rapid antigen testing as well. So we're committed. Testing is a tool for us to use, and it really has to be used with other public health interventions. And it's most important if someone is symptomatic. The asymptomatic testing gives this kind of broad community feel for what's out there, but it does have some downsides as well. So we're hopeful that this drive-through PCR, it's painless. You spit in this little tube. The only difficulty we have heard about is that for very small children, sometimes they can't produce enough saliva for the test. So, but we will have a lot more information on that as well. That is the end of my slides, and I'm happy to take any questions you might have right now or wait until the end.
Thanks, Ms. Bacalor. I will mention that I think I'm really encouraged by this this presentation, largely because we're getting the practice that we'll need to make sure that we're sustainable in the fall. And when you talk about 11 investigations in 1 day, and we're talking about a smaller number of kids in the classrooms versus what we will be looking at in the fall, it's important to get that practice and even understand what type of staffing needs we might have to take on with increased capacity. So strong work. Thank you so much for doing
that. Wasn't a good day, by the way. That was a pretty bad.
I'm sure.
I don't want to have that day every day.
Yeah, absolutely.
Right. And President Johnson, it is something on our list we'll be bringing forward. We will need to add a team in this area for fall. So we know up front that will be additional costs.
Oh man, I look, the tea leaves were rustling there. All right, great.